Hello friends. Today we're going to discuss about World Mental Health Day 2023. This year theme is Mental Health is a universal human rights. Our minds, our rights. Let's discuss about this theme. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. Every year, on 10th of October, we observe this day. We observe this day so that we can bring people together, unite communities to fight against stigma and discrimination with regard to persons with mental illness. It is also an opportunity to make policymakers, community leaders, and politicians to be aware of mental illness and its impact on persons with mental illness and their family members. As I mentioned, this year theme is Mental Health is a Universal Human Rights. Our minds, our rights. Every human being is born with inherent dignity and worth. This dignity extends to our mental well being also. It means that each person has the right to be treated with respect and without discrimination, including in matters related to mental health. That means just because Mr. X has person with mental illness, you cannot discriminate him, you cannot stigmatize him, and you cannot outcast him from the society. Every person, being a human being, he has this human rights to be included in the community. So this year theme, it's very clear. Mental health is a universal human right. Our minds, our rights. And this calls for an action to improve knowledge, raise awareness with regard to mental illness, drive actions that promote and protect everyone's mental health, and also persons with mental illness, universal human rights. This right is exercised against the state. As you know, mental health has to be considered as a basic human right for all people, not for just only persons with mental illness. That means every citizen has a right to the highest attainable standard of mental health. This includes right to available, accessible, acceptable, and good quality mental health care in the community, my dear friends. Now let's understand how mental health and human rights are interrelated. They are closely related, as you see in this figure. If a person develops mental illness, his human rights are violated. His properties can be taken. He can be thrown out of the family. He will be abused. Many a time, if she is a female person with a mental illness, she will be sexually abused also. That means mental illness leads to human rights violation. That means they are at high risk of human rights violation. At the same time, if a normal person's human rights are violated, for example, Mr. X, he is healthy, he is doing well, but his human rights are violated. If he is arrested without any reason and he is put behind bar, or he is abused, or he is sexually abused, that means if his human rights are violated, there is high chances he may develop mental illness. That means mental illness and human rights are they are the faces of the same coin, my dear friends. That means we need to break this vicious cycle. You need to uphold the human rights. At the same time, we have to make sure mental health care is available to everyone. In this regard, there was a landmark study done by National Commission for Women in 2016. The title of the study was Addressing Concern of Women Admitted to Psychiatric Institution in India, an in-depth analysis. This publication is available on the website of National Commission for Women, India. In this study, 10 mental hospitals were visited by the team of doctors from NIMANS and also by the National Commission for Women team. They visited and interviewed all the stakeholders with regard to mental illness, and also provision of care in these institutions. As I mentioned, the 10 hospitals were chosen randomly. They interviewed the women with mental illness, their family members, ward staff, administrative staff, and various other stakeholders were interviewed. I am giving the highlight of this study results. It says in all these 10 hospitals, they noted overcrowding 54%. They were not provided inner garments in 51%. They were not permitted to wear their own clothes in 47%. Inadequate participation in games and cultural activities in 45%. No toiletries were provided in 39. That means insanitary napkins were not provided, and they are not allowed to go out of the ward also. These were the simple human rights which were deprived in these institutions. The study also concluded just because a person has mental illness, his human rights are violated by various stakeholders. First and the foremost is the lack of support from the family, from the state, poverty, being poor, unable to access disability benefits, unable to access mental health care and rehabilitation. Further, the family factors such as burden of care, economic factors, social rejection, divorce by the husband or family members have rejected them and they have deserted them so that they have to be in the hospital only. Further, there are no facilities available in the community to provide care. That means least restricted environment. Providing mental health care at the primary care center is missing. Hence, these women were forced to be inside the hospitals, my dear friends. Although many of them were cured, but family members rejected them. They did not want them. And many a time, husband has remarried and he does not want this woman with mental illness in his home, although she is cured. That means it clearly indicates the way our society is treating women. In this regard, there was a landmark report given by the National Human Rights Commission. This report is available on NHRC website India. This report, which was released on 25th January 2023, what does it say? NHRC says 46 government mental health care institutions across the country depicts a very pathetic and inhuman handling by different stakeholders and issues notice to all the mental hospitals, to the state leaders, State Human Rights Commission, and also to all the health secretaries and chief secretaries to make improvement in these institutions. Not only, they made important observation. The NHRC said there are cured patients who have been kept in this hospital illegally. The simple reason they do not have any place to go. If they are discharged from this hospital, they will become homeless, mentally ill on the roads, my dear friends. Hence, they are staying in the hospital. Tomorrow, if the court issues an order to discharge them, the hospital will just throw them out of the hospital and then they will be wandering mentally ill at large. And they will be not getting any medicine. Nobody is there to look after them and they will have relapse. Further, they also noted that there is acute shortage of doctors and staff in these hospitals. So hence, my dear friend, this year theme, mental health is a universal human rights, is very apt. We need to understand that human rights violation occurs in double disadvantaged people. What does it mean? A person with mental illness, being a female gender, being poor, from low socio-economic status, from a backward community, from a broken family, or no family at all, third gender, homeless, mentally ill person wandering at large, migrants, and various other factors which play an important role in high risk, double disadvantage population, my dear friend. These are the people whom we need to concentrate and provide healthcare and also social welfare benefits to them. The state has to take responsibility of these double disadvantaged people, my dear friends. Let's look into the burden of mental illness in the community. A national mental health survey done in 2014 to 16 by NIMANS clearly reported various mental health burden in the society, especially in our country. This study was done before pandemic, my dear friends. Let's look at the prevalence of mental illness. We have 140 crore population. As per the study, 10% of the population requires mental illness care. That means mental health care is required in 10%, that is 14 crore population requires consultation and medication. In that, 0.8% are severely ill. It is approximately 1 crore people who have severe mental illness, who needs to be on medication, and there should be continuous supply of medication to them. Disability pension has to be given to them, and also family members need to be supported. But however, what is the treatment gap? Out of 100 people who have been diagnosed with mental illness, hardly 10 to 12 people are on treatment. Remaining 75 to 86% are not on treatment. As per World Health Organization, treatment gap means the number of people who have been diagnosed and they are not on treatment is the number. In India, it is 70 to 86%, my dear friends. That means there is no access to treatment. Even if they have access to treatment, they do not have insight. And many a time, the laws which have been formulated may come in the way of providing treatment to them. Similarly, there was another important study which was published by All India Institute of Medical Science. This was a study commissioned by Ministry of Social Justice and Empowerment in 2019. This was a study which is titled as Magnitude of Substance Use in India, a national survey on extent and pattern of substance use in India, my dear friends. If you look at the alcohol use, 2.9 crore people are addicted to alcohol or dependent to alcohol. However, 14% are using it, and 5.7 crore people are harmful users. But remember, 2.9 crore population is dependent on alcohol. It is not just 2.9 crore people. It is 2.9 crore families are suffering because the head of the family member is dependent or addicted to alcohol. Similarly, with regard to cannabis, 25 lakh people are addicted to cannabis or dependent to cannabis. However, the users are 3 crore population, my dear friends. With regard to opioid, 28 lakh people are dependent on opioid. That means it's just not 28 lakh, it is 28 lakh families are suffering because one of the family members is dependent on opioid, my dear friends. Similarly, with regard to cocaine, 10 lakh people are dependent. With regard to amphetamine, 18 lakh people are dependent. Hallucinogens, 12 lakh people are dependent. With regard to inhalant, that is petrol, eresics, which the children use, 7 lakh children are dependent on it. Think about it. The mental health morbidity in our society is very huge, my dear friends. Along with this, we are having one more burden, suicide in India. A total of 1,64,033 people death by suicide was reported by NCRB in 2022. Every day, 449 people completed suicide or death by suicide. For every death by suicide, there are 20 people who have attempted and failed. That means the numbers are mind-boggling, my dear friends. Approximately 35 to 40 lakhs people are attempting suicide in a year. And this is becoming an epidemic, my dear friends. In this regard, our country came up with Mental Health Care Act of 2017. This was a rights-based legislation which was implemented. And how does this Mental Health Care Act links and also compares with human rights? Section 18 of the Mental Health Care Act clearly talks about right to access for mental health care, my dear friends. What does it mean? It means outpatient and inpatient services should be made available to every citizen. The state should support the family of a person with mental illness. Rehabilitation services should be made available to persons with mental illness. Child and geriatric mental health services should be made available. Free medicines should be made available from community health centers and above, free of cost, my dear friends. That means right to access for mental health care has been clearly written, and this law has been passed in the parliament, my dear friends. Further, Section 18 also talks about community health centers and upward needs to provide medicines, and these medicines should be available free of cost. Not only allopathic, even Ayurvedic medicines, homeopathic medicines, Unani medicines should be made available for treating mental illness. And if there are no services available, Section 18(5), subsection F clearly says that government shall make rules regarding reimbursement of cost of treatment if those services are not available in the state. That means this right, which have been clearly told under the Mental Health Care Act of 2017, if they are not provided, compensation has to be given. To summarize, my dear friends, we are all sitting on an imminent public mental health pandemic. Post-pandemic, mental health issues are coming up. We need to act now. We do not act means we will witness high number of suicide, attempted suicide, drug abuse, mental health issues, divorce rates, school dropout, teenage pregnancies will increase phenomenally. That means we need to act now. Series of continuous sustained efforts are required, and we need to take it from a lifespan's perspective of mental health care, my dear friends. What does lifespan's perspective? That means from womb to tomb, mental health care has to be provided. In children, life skills training has to be done so that prevention and promotion of mental health is done. School mental health program has to be implemented at the earliest. Cyber hygiene needs to be taught to all adolescents and children. Interpersonal skills, intrapersonal skills with regard to emotional quotient need to be taught for every child. Access to mental health care should become a reality. It's just not a reality, it should be a right to access for mental health care for every citizen. Yoga and meditation need to be taught in every institution and for every citizen in the country. Mental health care at the doorstep for high support and high risk population should become a reality. Further, disability pension, caregiver pension for patients' family members who are providing support for a person with mental illness who requires high support needs. This caregiver pension is highly required now. Otherwise, state has to take responsibility of providing care to the person with mental illness. Instead of that, by providing pension to the family members, we can ask them to take care of a person with mental illness within the community, inside the family. Legal aid should be made available. It's not just made available, a quality legal aid should be given. A lawyer who is well versed with mental illness, mental health, and Mental Health Care Act should be given in charge of providing free legal services to persons with mental illness. Community mental health care, community psychiatry should be provided and also funded so that the care is provided within the community. Least restrictive environment should be the model of providing care to a person with mental illness. Hence, supported accommodation and sheltered accommodation should be made available by the state so that persons with mental illness need not move out of their house, or if they do not have a house, then supported accommodation can be given. Active role of the state is required at this point of time, my dear friends, to make mental health care a reality in this country. To conclude, we need to implement Mental Health Care Act of 2017 now, before it is too late. That means right to access for mental health care should become a reality in India. And we need to take mental health care to the doorsteps. We should not expect a person with mental illness to come to the hospital, because a person with mental illness may not have insight, and he may not be able to exercise his rights. Hence, my dear friends, mental health is a universal human rights. And our minds and our rights. This is an apt theme for this year. Thank you for giving your valuable time. Stay safe.